Welcome to Global Dispatches, a podcast for the foreign policy and global development communities and anyone who wants a deeper understanding of what is driving events in the world today. I'm your host, Mark Leon Goldberg, editor of UN Dispatch. Enjoy the show. On October 6, the World Health Organization, for the first time ever, endorsed a malaria vaccine. After years of testing, the vaccine was shown to be safe and effective at preventing deaths of thousands of children in Sub-Saharan Africa. The WHO's backing of this malaria vaccine is not only the recognition of a breakthrough in scientific research, but really an important moment in human history. Malaria is an ancient plague that has killed humans for hundreds of years, if not millennia. And though malaria has been eradicated in most Western and Northern countries, it still kills over 400,000 people each year, and most of those deaths are among children in Sub-Saharan Africa. My guest today, Margaret McDonnell, is the executive director of Nothing But Nets at the UN Foundation. Nothing But Nets is a campaign that raises money and awareness around strategies to fight malaria, including the widespread use of insecticide-treated bed nets, which is a proven way to sharply reduce malaria infections. She is a veteran in the global fight against malaria, and in our conversation, she explains the significance of this new vaccine in ongoing efforts to control and combat malaria in Sub-Saharan Africa and beyond. We spend the first few minutes of our conversation discussing recent trends in global efforts on malaria before having a broader conversation about this new vaccine. I do just want to once again emphasize how big of a deal it is that this new vaccine has been approved. It has been a very long time in the making. Decades of research have gone into producing a malaria vaccine, and it's a complicated scientific thing to do for reasons that Margaret McDonnell explains in this conversation. And she also notes that there are even more and new promising vaccines on the horizon. All right, now here is my conversation with Margaret McDonnell, executive director of Nothing But Nets at the UN Foundation.
Well, malaria is fascinating and has truly sort of altered the history of the world. It has been with us, some say, it started evolving 2.5 million years ago. So it's been with us for a long time. Many are saying it's the oldest pandemic and likely the most deadly pandemic that humankind has ever faced. Many people assume that, a shark or a tiger is the world's deadliest animal when it is in fact a mosquito. There's been amazing progress against malaria over the course of the last 2 decades in particular. More than, 60% of deaths have been averted. More than 40% of cases have been prevented. Large part because of political will and funding and mechanisms and programs, such as the Global Fund and the President's Malaria Initiative and the work of the WHO, and of course country leadership and on-the-ground health workers. So there's been amazing progress against this disease, but still today it kills over 400,000 people every year, and the majority of which, 67% of which are children under 5, particularly in Sub-Saharan Africa. So malaria is a disease that has certainly a disproportionate effect on vulnerable people such as children and pregnant women, and in resource-strapped, environments and communities and countries. So, there's been amazing progress, but a child still dies every 2 minutes, and so there's certainly a lot of work to be done to end the disease once and for all.
And beyond the deaths that are caused by malaria, presumably there's just like a lot of sickness and illness that holds back economies and societies and has just devastating impacts within households as well, I would imagine.
Yes, of course. So it's, when we talk about sort of the context of the sustainable development goals or the global goals, the world that we want to see, a healthier, happier, more equitable world, malaria sort of sits right at the center of many of these things. So malaria affects people economically. So at, as close to the household level, it means that parents can't go to work. It means that kids can't go to school. Malaria has a tremendous burden is a tremendous burden at sort of the family level, the community level, the country level, and sort of the global economy writ large, particularly in Africa, where 96% or so of malaria is most prominent. And then, right, you also have malaria can be a leading cause of absenteeism from school, as well as cognitive impairment of children. So we know that, when kids have malaria, they're not able to go to school, or their cognitive ability is impaired, especially if they have a more serious case of malaria. And there's also other intersections with poverty. It's certainly a disease of poverty, and greatly affects people who don't have access to quality health care. In the United States, we eliminated malaria in 1951. But still today, half the world's population is affected primarily in more resource-strapped countries and economies, such as in Africa and Asia, and parts of Southeast Asia and Latin America. So it's certainly a disease of inequity and a great historic injustice.
So earlier you referenced the Global Fund and the President's Malaria Initiative. These are programs that were launched in the early 2000s to galvanize international support to fight malaria, recognizing that it is this sort of terrible historic scourge. And it seems that those programs have been effective in reducing malaria deaths and malaria infections, starting around the 2000s. And it includes programs like yours, like Nothing But Nets, the provision of insecticide-treated bed nets in places that are malaria endemic. Can you just describe these kind of prevention methods and measures that have been undertaken, since the mid 2000s to so far reduce from an astronomically high number, the number of malaria deaths and infections? Like, what has the kind of global campaign against malaria looked like up until now?
Sure. Yeah. So like you mentioned, around the turn of the century, around 2000, big new funding mechanisms such as the Global Fund to fight AIDS, tuberculosis, and malaria, now known to be the Global Fund, the U.S. President's Malaria Initiative, and obviously with great leadership and support and guidance from the World Health Organization, country leadership, and of course, we want to recognize the critical role that health workers and people actually implementing these programs on the ground are playing. But there's been tremendous strides. Thanks to sort of infusion of resources and innovations, we have averted, over 1.5 billion cases of malaria and saved over 7.5 million lives over the last 20 years. The tools, the innovations that have been created, everything on the prevention side, from the insecticide-treated bed net or long-lasting insecticide nets, and there are some stats to suggest that about 67% of the reduction of cases of malaria is in part due to the bed net and the wide scale sort of scale up and deployment of bed nets, as they are extremely cost effective and relatively simple tool to use. But there's other important prevention measures, and more recently the seasonal malaria chemoprophylaxis, which essentially has been administered, particularly in really high burden settings for children to sort of get ahead of the most endemic malaria season. So there's really... It's
like a medicine that kids would take in malaria prone areas during malaria season.
Exactly. You also have, indoor residual spraying, which works well in a lot of settings. And then you have, there's prevention, and there's a diagnostics, and the diagnostics have, greatly improved over the course of the last few decades. Now we have rapid diagnostic tools where essentially you can go into a health clinic if you suspect malaria, have a finger prick, and within, 10 to 15 minutes be diagnosed. And obviously that enables then moving on to, the treatment side of things, where we have artemisinin combination therapies or ACTs, which essentially allow, if you're diagnosed, then you can quickly be treated and hopefully avert sort of a severe case of malaria. And so those have really been, primary tools that have been used in the fight of malaria over the course of the last couple of decades. And so, innovation continues, innovation is needed. These are critical tools and a lot can be done in terms of scale up and deployment. Yes, but all of them sort of need to work together as a suite of tools that are needed.
And so it is in this context that the new malaria vaccine that was just approved by the World Health Organization was tested and deployed. Can you just describe like the pilot tests and what that looked like and how those were conducted, where they were conducted?
Sure. Yeah. So it's been very exciting to see. I mean, this WHO recommending is the very first vaccine to address malaria ever that has been recommended from the WHO. It's actually the first vaccine to be approved that tackles any sort of parasitic disease, because parasitic diseases are extremely challenging. And so essentially, RTSS or Muscarix, is the world's first malaria vaccine shown to provide partial protection against malaria in young children in Africa and other highly endemic countries. This RTSS actually was started to be developed over 30 years ago. GlaxoSmithKline, and then with, around 2001, they partnered with PATH, and with support from the Bill and Melinda Gates Foundation, they entered into a partnership to develop the vaccine, really focus on infants and young children. And how it works is it actually aims to trigger the immune system to defend against first stages of malaria for when the parasite sort of enters the human host, as we call it. And so it's designed to sort of prevent the parasite from affecting the liver and multiplying and infecting the bloodstream. So in 2015, after clinical trials had been conducted or concluded, the vaccine got a positive scientific opinion from the European Medicines Agency and the WHO, who then said, it looked good enough to sort of recommend a pilot phase. And so that's what's been happening over the course of the last few years. The pilot phase, which was actually funded in part by Gavi, the Vaccine Alliance, began in 2019, and it worked in 3 countries in Sub-Saharan Africa: Ghana, Kenya, and Malawi. And it really worked through their already existing national immunization programs in those countries. And so since the pilot over the last couple of years, they administered, 2.3 million doses. And, long story short, which just came out, is that, the RTSS vaccine is proven to significantly reduce life-threatening and severe malaria among children by about 30%. And, also was really positive to see that the pilot demonstrated, also the vaccine safety, and also really underscored the strong community demand for the vaccine. Every time you introduce a new vaccine, as we've learned very well with COVID-19, you never quite know how the community will receive it. And, the pilots showed that it was well received and there's a strong demand for it.
And you said that the pilot programs, the tests, just included this malaria vaccine in the routine childhood immunization vaccine programs of the countries, right?
That's right.
Interesting. So, and it's kind of worth noting that many of the countries in the region actually have very robust programs to roll out their routine childhood vaccination. So they just included this in that process in order to conduct what seems to be a very massive pilot test.
Yes, exactly. And I know initially, before the pilot began, that had been a concern, because I think the initial clinical trials had sort of had the vaccines being introduced at times that were off the routine immunization schedule. But it looks like in the pilot, they fully integrated it into an existing routine immunization program, so that when children were brought to the clinics to get their other routine childhood immunizations, they just essentially incorporated RTS into it. I believe it is a 4-dose vaccine, so my understanding is it actually extended out. So one of the positive sort of externalities from this is that it actually extends, I believe, to 22 months. So the idea would be that you'd actually be encouraging children and their families to return to the health facility for further out than normal in order to get the 4th and final dose.
So 30% effective is sort of like an interesting number. I mean, on the one hand, presumably that means tens of thousands of children under the age of 5 will not die from malaria because of this vaccine. On the other hand, I feel like we as a human society have learned a lot about vaccines over the course of the last couple of years, and we are accustomed to like 90%, 95% efficacy. Is it because this is a vaccine for a parasite, which is something that is, if not unusual, unprecedented, that these numbers of efficacy are lower than maybe what we've been accustomed to when we think about vaccines?
Yeah, it's a great question. And so, yes, the modeling study that I think the Imperial College of London came out with said that if RTSS vaccine was implemented, it could prevent the deaths of about 23,000 children a year if the full series of doses were given to all, kids in the countries with the high incidence of malaria. So obviously, every life has value, and that is, obviously a very positive result. I'd say, the efficacy is certainly we wish it was higher. And an important, component of this is that the trials that have been conducted have shown the vaccine to have that effectiveness sort of when used in conjunction with other measures. So such as kids sleeping under, an insecticide treated bed net, or in the case of, there was actually a specific study done in Burkina Faso, an additional pilot study that was conducted in Burkina Faso, Mali, that tested the efficacy of the vaccine when used in combination with the seasonal malaria chemoprophylaxis. So I think, and that showed that actually the effectiveness, when all those things together, could be about reducing by about 70% hospitalizations and deaths. So, not insignificant. I think I guess what I would say about this vaccine is that it's, hugely significant. It's a huge milestone. It's groundbreaking. First malaria vaccine ever to be approved. It's a really exciting tool in the toolbox. I think it's just important to put it in that context, that it's not the silver bullet, pardon the expression, that we all wish we had, right? Even what we've seen with the COVID-19 vaccine is that it's not completely foolproof, right? So I think what's exciting is it kind of sets a blueprint for how we could look to incorporate vaccines as a tool in the toolbox, as we look towards continuing to make progress against malaria and really work towards a malaria-free world, which is ultimately our objective. There's a vaccine called R21 that recently there were some preliminary results that came out, and that actually uses the mRNA technology that was utilized in some of the COVID-19 vaccines that, at least in the preliminary results, have shown about 77% effectiveness in young children, which is encouraging, but, has not yet been fully piloted. So I think the early results of R21 are promising, but we have to wait to see what phase 3 brings in terms of providing a clearer picture and how it could be scaled up. So it's a great step forward. It's an important step forward, but it's not a silver bullet in and of itself.
So how do you foresee this additional tool, as you call it, being integrated and incorporated into national and international programs and policies to combat malaria? Like, do you foresee additional funding being raised to roll this out in many countries across Sub-Saharan Africa as part of like their broader malaria, mitigation strategies? And, is there like additional funding in like the pot for this kind of introduction of this kind of vaccine in certain places?
It's a great question. It's the question of the hour of the week.
That's why I'm asking you.
So what I think it's, now that we have the WHO recommendation, it's going to be really interesting to see sort of how things evolve over the next few months in terms of, there's not currently funding secured for the implementation rollout of this vaccine. What's needed now is, malaria endemic countries have to decide, whether or not they want to pursue adopting the vaccine sort of as part of their national malaria control program. So obviously we want to look to, community and country leadership to determine if this is a tool that they want to incorporate into their broader NMCP, National Malaria Control Program or strategy. And, global health funding bodies like the Global Fund and Gavi, the Vaccine Alliance, are going to be exploring over the coming months and years about how they might financially be able to support the integration of the vaccine. It's been determined that, the vaccine, I've seen anywhere from sort of $15 to $30 in terms of for the full four dose in the series. And that's not, it's not terribly expensive, but compared to some of the vaccines that are, currently being executed, like polio or measles, which are, cents on the dollar, it's a more expensive vaccine. And so there is going to be a question around how to fund this, through what mechanism. I believe the Gavi board is going to be meeting later this year, early next, to decide if it will be uptaking, the RTSS vaccine into its program. And then the Global Fund, is facing its 7th replenishment next year in 2022 that will determine basically the pot of money that they have over the course of the next 3 years to implement programs to address, HIV, TB, and malaria. And so this will obviously be an important consideration. There's still questions ahead in terms of how this will be rolled out, at what scale, who pays for it, et cetera. But again, a really exciting step forward.
Well, Margaret, thank you so much for your time.
Thank you. It's been a pleasure to talk with you.
All right. Thank you all for listening. Thank you to Margaret McDonnell. And I always love when I get to do a podcast episode about some great and positive development in the world. And I do often try to focus on solutions as well. I think solutions journalism is both an underappreciated and very important contribution to journalism more broadly, and I do a bit of it on this show, and I'm glad to. All right, we'll see you next time. Thanks. Bye.